Here's something that no one wishes to experience. A loved one is suffering from a medical emergency and needs immediate attention. You rush to the nearest hospital to get them the care that they need. A nurse explains how your loved one will need surgery and at-home care after the procedure. You and your family receive the information needed in order to provide the best post-operative care. Now, imagine that the education wasn't there. You are left in the dark, desperate to help your loved one to the best of your ability. Imagine a hospital staff stretched so thin that your family is unable to learn how to provide even basic post-hospital care. You are also unable to afford another trip to the hospital if your loved one showed symptoms again. Access to health education is something we take for granted, and a lack of it is an issue that many countries still face today.
Family members get hands-on practice with the help of the nurses and doctors. Noora Health utilizes the compassion and availability of patients' families to reduce hospital readmission rates. Through simple training measures, Noora Health has been able to reduce hospital readmission in the following 30 days by 24%. India's ratio of physician to patient is 0.7, meaning that there is less than one physician for every 1,000 patients, compared to the US ratio of 2.45. This is dangerously low for India's large population. This is even more troubling when we look at countries who have lower physician to patient ratios, such as Bolivia. In these countries, medical staffs are limited and cannot provide the extra resources needed to prevent families from readmitting into the hospital for the same issue. At Noora Health, the mission is to train patients' families' skills to improve post-treatment for patients in India. Noora Health turns hospital waiting rooms into classrooms, where family members learn vital skills for patients' recovery and survival.
Although Noora provides an innovative solution towards a lack of health education, the program could be improved. Family caregivers are required to sacrifice their time to provide in-home care, which is an opportunity cost for that individual. Caregivers could be using this time working towards their incomes. It is not obvious that the burden of care for inexperienced caregivers is outweighed by the marginal benefit that the caregiver provides when they participate in Noora Health's program. Noora Health makes the assumption that if families are willing and able to provide care for their families, then they should, but ignores the potential downfall that the opportunity costs of providing care might outweigh the benefit for the patient.
Noora has the potential to increase the scope of care through a provision of a telecommunication platform that allows direct contact between caregivers and medical professionals after hospital visits. This system of communication would supplement the benefit provided by Noora's hands-on in-hospital programs. The use of basic communication technology through an interconnected platform would provide an extended window of interaction, thus magnifying the current progress.
An online platform has the potential to connect and educate families on caregiving, which could provide them with the opportunity to give back to the community. This will lower the current costs associated with caring for a loved one and increase the quantity of people providing and therefore receiving help. By recycling the knowledge gained from the Noora Health program, the overall benefits will be compounded and assist in establishing a strong, supportive community. Noora's solution can be scaled to countries with similarly low rates of per capita doctor ratios. The use of Noora online would provide a sense of security and support for patients, while overcoming infrastructural limitations. Rather than relying on the initial training loved ones receive at hospital visits, the online support will give remote access to families in need.